biggest measure of our success with regard to improvements has been the waiting times for our patients have massively improved. Our current waiting times for priorities is 2 days, and our overall waiting times for all manual equipment is 12 weeks. And when we started this exercise, the waiting times were typically 12 months. My name's Rory Davis, and I'm Head of Service at Preston Specialist Mobility Rehabilitation Centre. As a centre, we are responsible for providing disabled patients within our catchment area with wheelchairs, prosthetic and orthotic equipment. We are at the end of many patients' pathways through trusts and hospitals. We work on behalf of referring clinicians, and I think we are a key part of their planning. And I think if we can't deliver in realistic times, realistic piece of equipment to the patients, then we are not meeting our role in the services that we're delivering. Our wheelchair patient referrals are generated by a network of referrers based in the community that covers our geographical area. These can now be occupational therapists, physiotherapists, GP surgeries, etc. We've worked with them to ensure that the information that they provide to us allows us to progress the patient's provision as quickly as we can. So the referrer provides us with the data and the information that we can then use to prescribe a piece of equipment quickly. Once the referral arrives in the centre, it's scanned onto our IT system and then goes into a job queue, and the admin person will then use a matrix and define a safe piece of equipment to provide. That then facilitates hospital discharge and priority issues. If necessary, the referral will be triaged by one of our clinicians, typically an occupational therapist or a rehabilitation engineer, and they will identify whether to procure or issue some equipment, or to call to a specific clinic, or to conduct a home visit and assess the patient at home.
Well, before the changes came into place, the admin team used to have to refer all the referrals over to a clinician for advice. Now we have a training matrix, which is a height and weight crib sheet, if you will, like a guide, and the admin person can actually issue a basic piece of equipment using that matrix. So for instance, they can look at the maximum height, the maximum weight for a particular model of wheelchair, and if the patient fits into that criteria, they can issue without the need for a clinician's advice. The clinicians really just do the more complex equipment now, anything that's over and above a basic piece of equipment.
It's allowed us to target clinical time onto clinical areas instead of doing admin, and then the clinicians can dedicate their time to patients.
Because when I first started way back, everything was paper, done on paper. Now we're all computerised, it's so easy, the press of a button. We have links with our contractors to deliver equipment, etc. So it's much quicker than actually posting the orders off.
It manages clinic appointments. It allows us to manage stock and asset track assets directly. And it also allows us to see a patient's history from all three services simultaneously. The benefits from Process specifically have been long-term and have impacted on every aspect of the service. So from the patient, for a referral for a patient being sent in, it now is scanned onto the system within 12 hours. That is part of our ISO procedure, so we have to achieve that. The referral then goes into a job queue, and if it's a priority issue which should be issued within 2 days, that allows the admin person to issue the equipment promptly from stock. Some additional benefits from Process are the fact that I can now run specific reports as required by the Trust and various reporting mechanisms. I can define exactly how many referrals I've had in a period. I can define exactly how many clinics have been conducted by whom and where. I can identify the equipment that we have issued or purchased, and I can asset track goods in the field should there be a safety recall.
I think firstly, from my point of view as a manager, it does give the team a more of a feeling of involvement, of being able to more satisfaction, more job satisfaction. But also it does help the patient in that they don't have to wait while the clinician looks at the referral and the clinician decides what to do, etc, etc. So it speeds up the whole process for the patient at the end of the day, which is really what we want to aim for.
Well, my name is Anne Court. I've been using the services of the Mobility Centre for several years now. I use wheelchairs. I can't walk without a full-length caliper. I need specialist shoes. Without the caliper I don't walk at all, so without the wheelchair in the house where I have a manual chair, I would have to rely on people for personal care. And with having the wheelchair, it makes me a lot more independent. Service as a whole, I think, is something that many other places could try to emulate, if not replicate in full, because of what they offer. Attitudes of staff, their willingness to go that extra mile, I find makes life. You might come in here feeling a little depressed, but you don't go away feeling like that, because they have done everything in their power to make things right for you.